Hello and welcome to this in-depth health episode. Today, we're exploring coronary artery disease, or CAD, a condition that affects millions globally and remains a leading cause of death worldwide. What is it? Why does it happen? How can we manage or even prevent it? Let's break it all down. Coronary artery disease is a condition where the major blood vessels that supply your heart, called coronary arteries, become narrowed or blocked. This happens due to a buildup of substances such as cholesterol, fat, and calcium, forming what we call plaque. The process is known as atherosclerosis. As the plaque builds up, it reduces the amount of oxygen-rich blood reaching your heart muscle. When your heart doesn't get enough blood, especially during physical exertion or stress, you may feel chest pain, known as angina. In severe cases, a plaque can rupture, forming a blood clot that completely blocks the artery, leading to a heart attack. So, what causes coronary artery disease? While the underlying mechanism is atherosclerosis, the risk factors play a big role in how fast or severely this process occurs. These include high LDL cholesterol, the so-called bad cholesterol; low HDL cholesterol, the good cholesterol; high blood pressure; diabetes or insulin resistance; smoking; obesity; lack of physical activity; unhealthy diet high in processed foods, sugars, and saturated fats; chronic stress; family history of heart disease; age, especially men over 45 and women over 55. It's important to remember that the more risk factors you have, the higher your chances of developing CAD. Coronary artery disease is sometimes called a silent killer because it may show no symptoms until a major event like a heart attack occurs. But there are signs to look out for. Chest pain or discomfort, usually described as pressure, squeezing, or fullness. Pain in the shoulders, arms, back, neck, or jaw. Shortness of breath. Fatigue, especially with exertion. Heart palpitations. Nausea or lightheadedness, especially in women. If plaque completely blocks a coronary artery, a heart attack occurs. This is a medical emergency. Symptoms include intense chest pain, cold sweats, nausea, or even fainting. Always call emergency services if a heart attack is suspected. If your doctor suspects CAD, several tests can help confirm the diagnosis. 1 electrocardiogram, ECG or EKG, records the heart's electrical activity. 2 stress testing, monitors heart function during physical activity. 3 echocardiogram, uses ultrasound to see heart function. 4 cardiac CT or MRI, gives detailed imaging of heart and arteries. 5 coronary angiography. A special dye is injected into your arteries to look for blockages on X-ray. Early diagnosis is key to preventing serious complications. Treatment for coronary artery disease depends on how advanced the condition is. Let's explore the options. Green salad 1. Lifestyle changes. Heart-healthy diet, rich in fruits, vegetables, lean proteins, and whole grains. Regular exercise, at least 150 minutes of moderate activity per week. Quitting smoking. Managing stress and sleep. Maintaining a healthy weight. Pill 2. Medications. Antiplatelets like aspirin to reduce blood clots. Statins to lower cholesterol. Beta blockers and ACE inhibitors to lower blood pressure and reduce heart strain. Nitroglycerin for chest pain. Hospital 3. Procedures and surgery. Angioplasty. A balloon is inserted to open narrowed arteries, often followed by a stent. Coronary artery bypass grafting, CABG. In severe cases, surgeons create new routes for blood to flow around blocked arteries. These interventions can be life-saving and restore heart function significantly. The good news is that CAD is largely preventable. Here's how. Know your numbers. Regularly monitor cholesterol, blood pressure, and blood sugar. Be active. Exercise is medicine for the heart. Eat smart. Reduce salt, sugar, and saturated fat. Don't smoke. Tobacco damages your arteries. Manage stress. Chronic stress can elevate risk. Stay informed. Get regular health checkups, especially if you have risk factors. Remember, prevention starts long before symptoms begin. Coronary artery disease may be common, but it doesn't have to be deadly. With early detection, consistent care, and lifestyle choices, it's possible to control CAD and even reverse its progression in some cases. Thank you for joining us today. Stay educated, stay heart smart, and take care of your most vital muscle, your heart. Until next time, stay well and keep living healthy.